Brendan Murphy, Greg Hunt, thank
Morning.
you both for joining us. Let's start with this. You were both at the meeting on Tuesday with Peter Dutton, this cabinet meeting. Are you certain you don't have coronavirus?
No one can be absolutely certain about everything, but all of our advice internationally is that the peak infectious period is when you have symptoms. There have been very few cases of people transmitting the virus in the 24 hours beforehand, so all the way through, our public health advice in our published series of national guidelines, which is the public health advice that the entire country's been using, where we define a close contact as someone who's been in contact with someone who is symptomatic at any stage or up to 24 hours before.
Because the confusion is you've got, the US Centre for Disease Control says some spread might be possible before people show symptoms. Mm-hmm. The World Health Organization says it is possible to catch coronavirus from someone who has just a mild cough and does not feel ill. So where exactly is this 24-hour window? Where's that from?
This was our Communicable Diseases Network Australia looking at the international evidence. You have to draw a line. You have to, in a public health response, you have to set a case definition, and that's what we've been using right across the country with every contact of every case.
So this is now the advice?
This has been the advice since January.
Okay, so the people watching out there, if they now know they've come into contact with someone with coronavirus, as long as it was more than 24 hours before they showed symptoms, they're fine.
They do not need to self-isolate. They don't meet our case definition, and we believe they're very, very unlikely to have been infectious.
Were you prepared to self-isolate, Minister?
In fact, the whole Cabinet was. And so I think that's an important thing. What we're very focused on is two things here. One is ensuring that the medical advice is paramount, and I understand there are many people with views, but if there was a breakthrough of absolute national importance on Friday, it was the agreement that the group of chief medical officers around the country, it's known as the Australian Health Protection Principal Committee, or AHPPC, is the paramount source of medical advice to the nation. That's been agreed, and we now have a unique wartime cabinet situation of a national cabinet which has been established. They have established, as we sought, the chief medical officers as their principal source of advice, and the medical officers have set out the conditions.
And I want to come back to that, just if I can, just on this particular case of Peter Dutton. Given you feel comfortable about him not infecting anyone at that Tuesday cabinet meeting, why then yesterday did we see cleaners in hazmat suits scrubbing the rooms where Peter Dutton had been on the Tuesday?
I think that was an abundance of caution taken by the people in the Commonwealth Parliamentary Offices. We don't.
And self-isolation would not be an abundance of caution?
The virus probably doesn't last for more than a few hours.
So why were they scrubbing it down?
I'd have to check with the people around that.
That wasn't a decision I'm aware of either the chief medical officer. And I'm not aware of any cabinet involvement in that. So
someone's decided that there's enough risk to send in fully clothed cleaners to scrub down the whole area.
Yeah. So
they didn't need to do that?
Can we step back a moment here? We are now heading into an unprecedented situation, not something that any of us have experienced in our lives. And our job is to ensure a number of things happen. One is that there is the preparation which began during January and has contributed to the spread being far slower in Australia, although we acknowledge that it's accelerating now. We've prepared both the system, but we've prepared the nation for the fact that
I appreciate
we're not
that,
immune,
but I want to get to the confusion.
We are going to face
I just want to get to the confusion
challenges.
that there is right now. I mean, people who were on the Qantas flight with Peter Dutton before your Tuesday cabinet meeting were also told to either self-isolate or get a test.
Do you mind if I answer this? Queensland Health has done what's called the case investigation, and they established, Queensland Health, the independent state-based body, they established that the relevant time for contact with Peter Dutton was the 11th of March. I would imagine that the airline, following the protocol, because it wasn't known at that time when the relevant case definition started.
But this is the thing, you said there's a lot of confusion out there. Qantas is doing one thing, your cleaners in hazmat gear doing another. You're saying it's very clear. It's not, is it?
The advice is clear. sometimes people, interpret the advice overcautiously, but our advice has been absolutely consistent the whole way through.
I do think there's a very important thing here, and I would not want some of the non-medical people who might be sitting on the panel to be giving medical advice to the country.
Sure.
And obviously I'm talking to Peter, that I think it's very important that we listen to the medical experts, and why this is important is to make sure that the right people are being tested.
And we're going to get to the medical questions
I would like to proceed, please, David.
Sure.
And the two fundamental conditions are, firstly, that somebody has either been in contact. Contact is being defined as symptoms minus 24 hours, or they've returned from overseas, and then they themselves have symptoms. Now, many people have understandably, where it's not known at what time the diagnosed person has developed symptoms, taken additional precautions, which is entirely understandable and appropriate. But once that contact period is known, then the greater detail is in place. So the rule for the country is being set out clearly now, and it's important that we follow the medical advisors and not the armchair experts.
There's slightly different, well, armchair experts perhaps, but there is also conflicting advice from the World Health Organization, and as I say, you've got conflicting advice coming from airlines and so on as well. So it is important to clear this up. They haven't done the
wrong thing because at that stage the time of symptoms wasn't known. Queensland Health and the Deputy Chief Medical Officer, who also conducted a case investigation, established the same thing and provided the same advice for this individual.
Let me get to a list of...
we will all be connected in some way over the coming months to people who are in some way either infected or isolated, and it's very important that our approach is one of national support.
Well, let's get to some basic facts here for people who are confused and wondering what's okay and what's not. Should people be shaking hands right now?
At the moment, we are strongly suggesting that return travellers should practice what we call social distancing. So that's keeping a distance of 1.5 metres, if possible, from people, not getting close contact, so not shaking hands, avoiding all public gatherings.
But as long as you haven't just stepped off a plane.
Yeah, or if you have been a contact with a case.
But everyone else can shake hands.
Yeah, that will change. As we get more community transmission, we are now in a phase of promoting broader social distancing. So I think as...
OK, and just on that, is it OK to go to the movies right now?
Well, this is an evolving situation, David. So
what's the advice right now then?
The advice right now is that as the first step, we are suggesting that all non-essential gatherings of more than 500 people not proceed.
OK, but a cinema less than 500, but you're still sitting in a room, an enclosed room for a couple of hours with people.
Indeed, and the new cabinet has asked the health experts to spend... We're spending 2 days on Monday and Tuesday working out a more nuanced interpretation.
OK, but today, if I got a ticket to the movies, do I go?
The risk is relatively low at the moment because we've only got 250 cases. The move to reduce mass gatherings is a preemptive move.
So it's OK to go to the movies?
The epidemiology is evolving, but as the case numbers increase, we will be likely recommending increasing measures of social distancing.
Sorry to press on this, but people are wanting some specifics. You're saying it's OK to go to the cinema today. What about the gym?
I think the gym is fine, but everybody at the moment needs to practice very good hygiene. So if you're going to the gym, I would be very focused on hand washing, using hand sanitisers, all of those social distancing, good hygiene measures. We want everybody in the community to start practicing those and to start thinking about how we will do social distancing in the future.
The next phase of our public information campaign begins today. We've already had...
But it does. I've seen that, but it doesn't explain a lot of these basic questions. What about trains and planes? Is it OK to travel on?
It's designed to be, firstly, very simple, so as people can understand.
It's general.
Helping to stop the spread.
Yep.
Secondly, to be flexible, just as Karen was talking about, the ability to step up both information and measures as we have done, which is...
And that's what I'm trying to get
what we've done. And then thirdly, to direct people to, if they need additional information, to health.gov.au, health.gov.au.
But does health.gov.au have these answers? What about riding on a train? If you have to catch the train to work, it takes you an hour, is it OK to be on that train?
At the moment, we are not suggesting that people should stop using public transport. As the situation evolves, every day we meet as the experts for 2 or 3 hours, and we're looking at the case numbers, the evidence of community transmission.
So this might change.
This will change. Our social distancing measures may well change over time. At the moment, we are ahead of the curve, and we're moving earlier than most countries have on public gatherings.
If you're over 70, should you stay at home?
If you're over 70, you should be more careful, particularly if you've got chronic disease, more careful about social distancing.
So things like trains and cinemas and so on.
I think you would be more careful about those things at the moment.
What does more careful mean?
Avoiding things that aren't essential.
So if you're over 70, don't go to the cinema.
Well, I think you would think if you're over 70 and you've got chronic disease, at the moment the risk is very low, but you might want to start thinking about taking more social distancing measures in the future.
Can I talk a little bit about the course of the next 6 months? Because I think what everybody is looking for is the course and the perspective.
Well, I think we're looking for some details.
Yeah,
but what they should do today. I get your point that it's important to look at the long term. But right now, people don't know whether to go to the restaurant
and I will
or the
address
supermarket.
that.
Yep.
So the advice which was given by the medical experts and accepted by the National Cabinet that was formed on Friday is that mass gatherings being defined as 500 would become the threshold. They've actually brought that forward. Some have asked, have they pushed that back? It was the opposite. They brought that forward far earlier than might have been necessary if you were doing a stepped approach, but out of the abundance of caution. So whereas other countries with far higher caseloads have brought those in, but they have brought those in when the caseloads have been much, much greater than Australia. So in terms of where we're at in our national caseload, this is coming in dramatically earlier than in many other countries.
Can I ask you about that, Professor Murphy? Was this based on medical advice, the Monday advice?
Absolutely. We made the decision to recommend to government on Friday. We thought that the decision should have been made then earlier than we might otherwise have done. We were initially talking about expecting greater community transmission before we introduced these measures, but we felt that it was time to make the decision to give a bit of time for adjustments.
But not this weekend, so it's okay to go to the footy today, but not tomorrow?
These things they're not black and white. As the caseload grows, you start introducing measures, but our decision on Friday was that Monday was an appropriate time on the predicted rise in cases to introduce it.
And that is bringing it forwards. The other thing is we view this as a 6-month window for Australia. Now, that time might be shorter, it might be longer, but that's our best estimate on the arc and the course of the virus.
And where is this heading in terms of, I see the Victorian Chief Health Officer saying you should go out and buy enough food to last 2 weeks. Is that your advice as well?
I think that's a little bit premature at the moment, but I think
who do we believe, you or the Victorian
I think
counterpart?
We're generally at one on all of our advice.
Well,
I think that for most people, I think we don't want to encourage major panic buying at the moment. That we've seen that with the supermarket chains, but I think it's probably sensible to have a few days of supply. Yeah.
Can you see? I mean, you're talking about we're all unified now, and we've got this national cabinet, but we got the state saying go and buy 2 weeks worth of food. You're saying don't worry about that.
No, I'm not saying don't worry about it. I'm just saying that we will get proportionate collective advice. There are sometimes people in one jurisdiction who are a bit more forward-leaning because of the circumstances in that jurisdiction, but our advice to governments has always been unanimous. So our advice on the social distancing was unanimous. Our advice on border measures...
What's the thinking on schools at the moment? A lot of people are asking about this. It is a difficult one. Are we going to... some schools are taking it upon themselves to close down. Do you think we're going to see, Minister, more school closures?
Let me look at the broad question here. There is the potential, and when we're looking forward over this course of the next 6 months, we are rightly keeping all options on the table, whether it's in relation to travel, whether it's in relation to schools. The schools question will be very much guided by the medical advice. One of the things that they have talked about is not moving too early on something like that because of the balance. that many children, and I understand one of the leading state education authorities in New South Wales pointed out the risk of children being with grandparents, of taking parents out of the workforce who might be in the health and medical sector, disrupting supply chains. So maintaining the structure of society to maintain the support. And also, and Brendan can address this, the question of infectivity and impact on children of the disease.
So one of the interesting and positive aspects of this virus is that there have been very few reports of symptomatic infection in children. What we don't know is whether children are getting infected but just don't get symptoms.
They can still spread it.
They can still spread it, or whether they're not getting infected. The former is probably more likely, but in a way, if they are getting infected and they're perfectly well, whilst they might spread it, it also creates a herd immunity. So there's lots of complex questions about
So we're not there
schools.
yet, but this might be.
There's no
That's
question that we have a range of social distancing measures that we will not hesitate to recommend to government, but they've got to be proportional, and they might last for a long time. So you don't want to move too early.
And we know politicians can be infected. Do you think Parliament should sit next week?
Parliament is planning to sit next week. They are taking measures. I think if they can take measures to reduce public traffic, and I know they're going to do that.
Reduce the number of people in the building.
Correct.
MPs as well as staff?
They are just. I had a meeting with the presiding officers yesterday, and they are looking at a range of measures to reduce the number of people in the building, including staff and visitors. School groups are nearly all cancelled now. So I think Parliament, it is important that Parliament sits, because it's the last time before. The Minister can obviously speak to that more than me, but I think they're very focused on making sure.
You have a limited number of MPs, a quorum basically, rather than everyone being there?
Look, the presiding officers have been taking the medical advice, and they are working to make sure that we operate within exactly the same parameters as the nation. And so when you think of what our responsibility is here, starting in January, to make sure that we did all the steps to contain and slow the spread of the virus in Australia, and that has so far put us at a far lower rate of infection than many other comparable countries that received their initial cases at the same time. We were able to contain the 15 cases from Wuhan, to carry out 3 successful quarantines, to slow that, but we've been very upfront that we're not immune. These are unprecedented measures, as I say, a wartime-like national cabinet created for the next phase. And the way we view this is always trying to do things ahead. The mass gatherings situation has been brought forward. And then the next stage of the information campaign is bringing people in so as they can help stop the spread, but they also have the specific information that if they meet that definition, then that's appropriate to be tested. Okay. But if they don't meet that definition,
they don't need to.
There's no need.
Let me ask you finally then, this staged process, could we reach the point that we've seen now in Italy, France and Spain, where we have the complete lockdown in Australia?
It is potential that could be the case, but that may be focal. So we don't. One of the things we know about outbreaks of infections is that they can affect one part of a country, not another.
So you could lock down part of Sydney, but not the whole country.
You potentially you could. I mean, look, the Koreans did that for 2 provinces very successfully, locked them down. So everything is up for consideration. Government, the premiers and the Prime Minister said to us, the health advisors, give us your fearless advice, and we will take it.
Okay, we are going to have to leave it there.
I will just add something.
Just quickly.
There are no options that are off the table. The paramount goal, and the Prime Minister said this to me at the outset, is protecting the health, and that's why, to make a decision to close the border with China on the 1st of February was extraordinary and unprecedented. It was in a global context where it probably was going to hurt Australia more than almost any other country, and yet we did that. And so our task is to not only prepare, but to say to Australians, these will be challenging times, but if we all work together and have that wartime spirit, then we will get through this.
All right, Minister Hunt, Professor Murphy, thank you both very much for joining us today.
Pleasure, David.
Thanks, David.